welcome everyone. Welcome to Access with Lydie, where we spotlight bold ideas and breakthrough leaders reshaping how we think about access to care. On today's episode, we have a special guest, someone who's doing just that, taking bold ideas and reshaping how we think about healthcare. Today, I'm joined by Chris Cruttenden. Did I get that right, Chris?
Perfect.
Okay. Thank you. President of Safety Net Connect, a company on the front line of innovation in healthcare access. Chris, I'm so glad to have you here and just welcome to the show. I know it's going to be a really great opportunity for us to learn more about the work that you're doing, but also why Safety Net Connect is an organization that we should have on our radar. So let's start at the beginning. What inspired the launch of Safety Net Connect?
Well, first of all, thanks for having me, Lydie. I really
Yeah.
appreciate it. You know, it was an interesting technology. Always comes out of accidents or perceived problems in creating a solution. Way back in the day, we were doing a lot of programs for medically indigent or indigent, which we're not really using that term today, but back then, indigent patients, and patients were kind of in and out of the ER and bouncing around. And we started crafting a data collection system so we could actually understand what medications they were on, what services they had. And during that time, a doctor named Hal Yee, I like to give him the credit for it, came down from San Francisco and presented to us this idea called e-referral consult, where we would triage patient's need for a referral or help co-manage the PCP and the patient in the doctor's office. And when I saw that, I said, this could really solve some of the issues that we were having across Orange County. And got together with my partners, the Safety Net Connect, and we actually built a system and gave it to a couple nonprofits at the time, Comida de Salud in LA County, as well as a group called Access OC that was focused on giving access to specialists down here. And they played with it for about a year and a half, and it started getting a lot of momentum, and it was really making an interesting impact on actually on the patient side. Like, they had less travel, they were happier, they were happy that their doctor was talking to a specialist on their behalf, and it started getting noticed. And right at that time, Hal Yee and a few other people came down from San Francisco and said, we want to implement this idea of eConsult across LA County. And we actually wanted to implement it for multiple patient populations. And we raised our hand, as well as a few other people, and showed what we could do and how we could do it. And the results were amazing. And not to harsh on what LA County was doing way back in 2008, but it was a year wait for GI doc. It was 6 to 8 months for dermatology. And we got those down to access within a couple days, where you could actually have a specialist talk to the PCP. But then from that standpoint, we, over the course of a couple of years, it turned into a best practices, expected practices time frame. Hey, I did these tests and did these things with the patient. Let's now talk to the specialist within a month or 45 days or 2 weeks, whatever that was. And we've really reduced the wait times, decompressed these specialist clinics, and actually the effect was a chain reaction of events where we've calculated, and this is a pretty bold statement, that through a bunch of white papers written on the different eConsult solutions, that we're saving LA County around $68 million in value a year annually. And that is that, yeah,
That's huge.
It corresponds to quite a few factors. Less travel for the patient, quicker access to care. What would happen previously is the patient could not get work off and see the specialist. They'd miss that appointment and they would end up in the ER. The ER would be more expensive. Now, LA County pays their doctors, so the value, return on value, is what we're quantifying as the money saved versus money spent, because it's a contained system. But through, and I'll give you a copy of the white paper to share if you'd
Yeah.
like.
Yeah, we can definitely add it in the show notes so that individuals watching can be able to see this. And what I'm hearing you say is what you did is you found an opportunity to build something better. You found a way that, this was presented to you, you being a tech guy and just wanted to do something. You found a way in order to not only provide a benefit for nonprofit organizations, but what I'm hearing, it was able to be scaled where it's a benefit to the county overall. And that's a really big thing. And I think that a lot of decision makers, especially within the healthcare ecosystem, that is usually what they're looking for. They're looking for a way that I can scale an impact. I can scale what it is that we're doing. So this kind of goes into like my next question for you, especially for our audience of healthcare decision makers, some hearing about Safety Net Connect for the first time. How would you describe what you do to the decision maker in healthcare and like why they should think of Safety Net Connect?
First of all, I just want to say I love that concept, and I'm going to use that scale of impact. I
Yeah,
mean, I haven't really heard of it that way.
yeah.
And I would like to describe Safety Net Connect as when we come in, we do a scale of impact,
Hmm.
especially in a situation where you are having trouble with getting specialists, access to specialists, specialist wait times. We've done this. I would say LA County, and probably will refer to them quite a bit, is the second or third largest health system in the country.
Hmm.
It is massive. It is bigger than multiple states.
Yeah.
Um, and to do that across that system, which you do have actually, interestingly enough, rural, urban, suburban, and then traffic as a massive barrier.
Hmm.
Um, we can handle any situation. And so when we've been brought into, for example, Inland Empire, analyzing the makeup, what we've done, and how we've done it, we came in and said, wow, we can do this across the health plan for Riverside, for San Bernardino, use the specialists that are available now that are local, augment with specialists that they don't have access or they have limited access to, and then help to recruit more local specialists in the area and bring them on the system.
Yeah.
And that's where we really feel like if you choose us, we will scale the impact. And weird thing to say, but put them in the business of this software solution of eConsult. That's what they're doing as a service, as a benefit for their patients, versus just hiring us. We do a few things and they kind of forget about us. And maybe it works, maybe it doesn't.
Hmm.
We never stop
Yeah.
growing and scaling and adjusting with our clients.
Yeah. And what I'm hearing you also say is, which is, if you're in healthcare for a reason. There's a passion, there's something that is keeping you going and waking up every day to move forward. One of the things I'm hearing you say is with this solution, with the Safety Net Connect, not only you are providing a support system for the health plan, the nonprofit, but you're also providing a way for the patient themselves to be able to access care in a way that's on their time. I heard you refer to this earlier where it's like, I now don't have to miss a day of work. I can, for an appointment that it may not be the right appointment for me or anything like that. I now have a more likelihood in order to see the right patient. I'm not see the right, but see the right provider at the right time, at the time that makes sense in my treatment journey or my patient journey. Is that what I'm hearing correctly?
Yes,
Hmm.
and health plans do a great job with the resources they have. So
Yeah.
I'm not trying to knock any health plan,
Yeah, yeah,
but
no, no.
um,
We're not doing that here. We're not doing that here. It's more of what can we do to even make it better? How do we evolve?
yeah,
Yes.
it's funny because we've worked Cook County, Illinois, South Side Chicago, very very tough areas, limited access to even PCPs and other resources. Parts of LA County very difficult, and the complaints are the same for these patients. Um, you know, they reactionary go to their PCP because they're feeling at their worst. They do get in. This is prior to what I would call the eConsult and some of the tougher systems where there's access, and they get thrown over the wall. And thrown over the wall is, hey, you're going to get a referral for a GI doc. that has to be approved through an auth approval. That comes down, then we schedule you. The scheduling is out 6 months. You are double or triple booked because there's a high no-show rate. By that time that comes, do you get that time off? Do you have somebody to help watch your kids? Do you have transportation lined up? Those are a lot of barriers. And the worst case scenario is you get there and this specialist goes, oh, well, I need you to do these tests. I can't help you until you do this. Or that's nothing. You didn't have to come all the way in for that. I could have told your PCP that. And so the impact and benefit, this patients love it the most. There is more work for the PCP, which, it does get easier because they are learning about certain things and what a good referral is. But overall, I think the patient's getting care better, sooner, with less travel and less frustration. And even in commercial care, I'm sure it happens to people who are listening. Yeah, I've gone to the specialist and they're like, well, you need to do these things, or I need to do an echo or whatever. And it's like, well, why didn't somebody line that up and tell me ahead of time? So it is something that can be used everywhere and for everyone, but in Medicaid, it is, I think, a boon for the
Hmm.
patient.
Right.
And
Right.
the specialists do like it too. They
Yeah,
they
that's
like
what
the
I'm hearing. That is what I'm hearing. And one other thing I want to ask you, and because we know someone can be listening to this podcast and they're just like, oh, okay, well, that's just like one specific area. I heard you say that, you guys are also working with Cook County in Illinois, not outside of California. Can you share just like a real world example of safety net like in safety net connect in action, like maybe a story where your solution made a measurable difference for like a specific organization, that our audience can kind of like tie into, just kind of understand a little bit more.
So yeah, we were working with Cook County, and we are no longer. They adopted kind of a more of a electronic patient record to
Okay.
do referrals and eConsult. I don't know if they're actually even doing eConsults within that system, but
Okay.
that's kind of the evolution of health plans. A new guy comes in and says, we're going to use this new technology, and that's
Hmm.
fine. The biggest impacts I've seen, actually, I see them all the time, but LA, obviously, LA County with the value and the reduction of wait times, and also an Inland Empire is a really nice example. Um, the distance between some of these clinics and specialists is pretty wide, and as well as augmenting and bringing in specialists, even from LA County, that understand the system
Hmm.
and how they've been doing it for years, and now they're helping another county that has Medicaid patients, and maybe even cross borders, and they end up in LA for a while and end up in Riverside or San Bernardino,
Yeah.
and that's kind of neat because we're in essence using a technology to share knowledge and experience across multiple regions,
Hmm.
and that is something that um, uplifts the health plans, the counties, and the patients. And we're starting to see that even broader. So, LA County and Riverside and San Bernardino, the sharing of resources. But we're working in the state of Colorado, and you have the western slope, and you have Denver. They're literally almost two states apart. And the resources cannot be shared. But through something like eConsult, we're able to bring Denver specialists to the Western Slope and vice versa, who's ever out in either way, and sharing of resources and experiences and understanding, which I think is the new model. I wouldn't want to say being a doctor or a specialist is a gig economy quite
Hmm.
yet, but that shared or even leveraging the excess capacity of these physicians that are in a region and bringing them farther out.
Yep.
And then even other states, not
Yeah.
all states allow it, but other states.
Yeah.
You always want to use local, and you always want to use um, the groups the health plan really feels comfortable with.
Hmm.
That's not enough in a lot of these situations. You have to
Yeah.
augment. So
Yeah. And I'm hearing that, especially where you have, I mean, if we think about the current workforce when it comes to healthcare, we know that over the next couple of years, we will see and have seen a decline when it comes to like providers and especially like different specialties. And so, from what I'm hearing you say, is that we have an opportunity that right now, where we have potential gaps for like a rural area or certain locations that may not have access to a specialist, we now have an opportunity to connect that specialist with those individuals, with those patients, with those PCPs, so that they're not feeling that they don't have a place or way in order to provide treatment to their patient population. Can I say that correctly?
yeah, yeah.
Okay. Okay. So, one thing that you shared earlier that I was just like, yes, tech is a game changer. Like, if we did not have technology, we would not be able to do what we just shared before, which is be able to connect a patient in one state with a specialist in another, like, especially if it's like a next state over, because there is not a provider that with that specialty in their local area. Um, but one thing we know for sure is the adoption of technology can be tough. And depending on being able to just bring in a new thing, sometimes people are like, I just don't have the capacity for something new. So, how do you design or how have you designed Safety Net Connect for both the innovation, which is, the connections that we are now making, but also the ease of use for your PCPs, your health plans, whoever it may be that is using your technology?
Um, Man, I'm sure there will be some PCPs arguing with me on this one. Asking any PCP, and I actually feel bad about that. I'll lose sleep asking a PCP to do one more thing, log on to another system, or take an extra step in the day to do that. So, in the beginning, we tried to keep it as simple as possible, and even uh, to the point where you didn't have to be trained on it. You just stepped through. I found the patient. Here's my question.
Hmm.
Submit it or upload
Hmm.
a document. And or as it has been curated by physicians and where they want to go with it, it's really a little more complicated as far as the things you can do with it, but less steps, less clicks. And where we're going with it right now, we have a lot of things we've built, but it's just a matter of being allowed to implement them. Is more seamless integrations with Epic and Cerner and pulling that information forward, but actually even creating the consult off of what's available in the patient's
Hmm.
record and teeing it up for the PCP so they can have to do less. The other piece that we're working on right now is basically the AI and dictation, where it actually generates the record, which is already being done right now without us. But if they would say the keyword word, this could be an eConsult, teeing that up and pre-filling all the aspects needed for the eConsult. What I'm trying to do is remove all the barriers as possible and let the PCP be the PCP and do the
Yeah.
work. And then not every patient needs a consult. Um,
Hmm.
but just having somebody go out of their day and try to do this information slows them down and takes away time from the patients,
Yeah.
even though they're working on behalf of a patient's
Yeah.
behalf for better care. So those are the things that we're going, and then the future I see, which is probably a little controversial, is really deep diving with a type of AI analytics and and going out and finding potential consults before the patient even comes in. And
So, like, are you
I,
saying like scanning their records to see like a pattern, if a pattern exists?
yeah, that's pretty
Okay.
controversial. I don't know if anybody
Yeah.
wants. Do I want somebody to go to my doctor my record? But
Yeah.
we have some populations that we're managing, diabetic,
Hmm.
and the doctor hasn't seen them in a year or so, and it'd be really
Hmm.
nice to go in and say, hey, we should maybe triage, alert, manage, find out what's going on, and maybe tee up a potential consult at
Yeah.
some point. for these patients. Now that's far off, and nobody has to worry about anybody going in and reading the records, but there are interesting opportunities. I mean, for me, I did a funny experiment just the other day. I took all my labs. I get my blood tests every year, and I mapped them in a private AI, not something where I put all my information online, and charted it. And it was really interesting, the feedback I got, what I'm doing, what I'm eating, where my health is going to be
Mm-hmm.
in the next 5 years if I don't change certain things. And I thought there's a lot of potential there
Mm-hmm.
for the average patient.
Yeah. I think the concern always comes from I may not be familiar with this specific technology and it's telling me these are the things, and does it have enough data to be able to provide me with the feedback that'll aligns with me. Like, say for instance, if I put my labs in and you put your labs in, for instance, and we don't provide context that I'm a black female and that you're a white male, it could give the wrong information as far as feedback. But if we have additional context, we can probably, do something where it's like, oh, just like you just got, your feedback, it, we could potentially know certain things that are coming down the line. And I think there's always going to be a time and a place for AI. It could be where 5 years from now we're having a very similar conversation and someone mentioned this and they're like, oh yeah, that's nothing. Or the reaction can be like, no, we can never do that. I mean, even when you think about ChatGPT and the role that it has in technology now and how it has been helpful, there is always, I will always say, there's a place for technology. It's just how you're using it and how you're applying it. But when we're dealing or interacting with a population such as large as the Medicaid population, we do have to leverage the tools that we and resources we have. We just have to also be good with those things. And we'll see over time, like what that includes when it comes to AI application with that population, or how we serve that population in a way. But you always want, at the end of the day, to provide something that is thinking for the patient in a good way and really providing access to care so that they can live and have good well-being. So
Yeah, yeah, and there's a lot of low hanging fruit for us.
hmm
It's very straightforward. I mean, Hawaii is another example. There's just not a lot of specialists that live there,
yeah.
and they really can use people bringing over virtually, and not just video, but asynchronously, specialists assisting, supporting,
hmm
whether it's PCPs or other specialists,
yeah.
to just basically decompress some of these clinics.
Yeah. So,
So,
well, thinking about that, what does a strong partnership look like with Safety Net Connect?
well, I like to consider us partners with all our health plans. There isn't any other way to work, and that is a really great example is how innovative uh, Colorado Medicaid, and their whole view, really trying to use eConsult to. I mean, they have urban, rural, and
hmm
then this new term frontier. I've never
Oh,
heard
yeah.
of.
I've never heard of that. What's Frontier?
It's somebody living in the forest in a cabin that needs access to care, which is true.
Oh, well, you know what?
And
It literally, the definition sounds like what
yeah,
it is. So,
yeah, when we were in a meeting with a clinic, they were describing that, and I was like, "Wow, that's a new term for me."
yeah, it is. Okay.
Glad I gave you a new term.
Yeah.
Um, but the partnership on all levels, where it's a little different than California. They have these things called RAIs, which are regional accountable care organizations, and they help manage populations within each area. Uh, we would go in and train physicians and onboard them, and we'd get a lot of support on how we were going to do that with the state. In addition to that piece, whether it was trying to understand and figure out incentives for PCPs, but also recruiting the available specialists locally, which was the first priority, and then if we couldn't find them, allowing us to expand and look further out in the state or further out in other states, but getting them credentialed and licensed in that state to support the population. And all those ideas are wonderful. It's all about the patient. What can we do? How do we get them access to care? How do we provide them better care? And try to make it as easy as possible
Mm-hmm.
for the physicians, which are the PCPs with the heaviest lift. Um, and we love to go in that. And if you need us for the footwork, we'll do the footwork. If you need us on the higher level, if you need us to recruit, if you need us to even come up with ideas on technology, where because everybody's process is a little different.
Different.
We're willing
That,
to customize
yeah.
and change according to how you do your work, and even how the population reacts
Mm-hmm.
to these services. So
Yeah. No,
hopefully
yeah.
that described how I'd be a good partner.
No. So let me ask you one question. Who is your ideal partner? Who's your ideal partner for Safety Net Connect?
Ideal partner client,
Mm-hmm.
a Medicaid health plan in an area that is urban and rural with limited access to specialists. We can solve your problem today.
I love it. So for leaders tuning in, when they're thinking about Safety Net Connect, who's the best person on your team to connect with? Is it you? Is there someone else you kind of want to shout out for that?
Keith Matsasuyu is
Mhm.
my partner in the company. He has built a few IPAs in California. He has developed care programs, referral programs, care management. He really, really understands the market, and he can listen and understand and help provide not only advice with our focus on eConsult, but also on other aspects. I mean, it's fun to sit in these meetings with him and listen to him.
Okay.
So he's great.
Yeah, so you kind of went into my next question is looking ahead, what's next for Safety Net Connect and any exciting launches or expansions on the horizon that we should be aware of?
Um, right now, there's a couple big clients I can't mention, but statewide opportunities where we're doing the same thing, taking the limited resources of specialists in a given area and expanding that and bringing in using the local ones and bringing in more to help offset any access issues. Um, and then technology wise, our goal is to, it doesn't need to be medical only. You have a patient that they're diabetic and you're like, hey, great, your A1C is really fantastic. You need to eat healthier food. How do I do that? Well, in California, they have a CalAIM program. You can actually refer them to an MTM program, a medically tailored meal.
Huh.
Whether it's a produce food box grown in real soil that has real vitamins,
Hmm.
or a meal specific to dietary restrictions or allergies. That is something makes a lot of sense as an eConsult or just an auto referral within that eConsult system marketplace. Another one that we've been doing for LA is basically smoking cessation. That's
Mm-hmm.
not really medical, but sure does contribute to
Yeah,
medical. And
yeah.
that's another. And so some of these SDOHs should start to be, I think, referrals within the system or consults within the system, where I've done one aspect and I've helped the patient, but there's these other pieces that there
Hmm.
really isn't the resource available in my current EMR, in my
Yeah,
current system,
yeah.
to provide that benefit.
Hmm.
So that's where I'm hoping in the existing areas we're working with our client partners to expand the marketplace of services for the patient and PCP, but then also um, in new deployments, think of it more than just medical.
Yeah. What I'm hearing is an opportunity for one of our viewers to think and maybe even bring you a proposal as far as like, hey, this is how I'm thinking you guys can expand when it comes to social determinants of health and how you can leverage what you already have so far. So definitely the case. Um, next question to you is when you're thinking about access to care, especially for the Medicaid population, What if you had a magic wand to envision something to be better in the next 3 years? What does that look like for you?
Man,
Magic wand, Medicaid population, I can make this happen.
God, man, that's a tough one. It kind of goes back in a little bit of a different direction.
Hmm.
I was at a conference and they talked about patient populations and ethnic populations and the disparity in care. And if I could wave a magic wand, if everybody who goes to college for at least a few years, their disparity in care, no
Hmm.
matter man or woman, well, age is limited because they're usually around the same age, and
Hmm.
ethnicity gets real close. And it is an understanding from not only your professors, the school, and your peers that, hey, binge drinking and smoking is obviously bad.
Hmm.
Um, Doing drugs or eating really crappy food. And we see when people go to college, their health is generally better. And that's what I would wish for this Medicaid population is more education opportunities. If
Hmm.
I were to wave a wand and they understood, and it's kind of funny to say that, oh, they should know. Um, they don't.
Hmm.
People are busy. They're
Yeah.
working. They hang out with other peer groups that are maybe not eating great food.
Yeah.
And that would be kind of my education wave of the wand, which I think would eliminate or alleviate a lot of the need for a lot more intensive care. Because I don't want
Yeah.
to wave a wand and say, we need more care. I
Hmm.
want to wave a wand and say, the patients need less care because
Yeah.
they understand what contributes to making them sick. All right.
That no, that's actually a really good. I never thought about it before, but I mean, it goes back to public health education, and that kind of aligns with it, where you have programs that are created to let the client or the patient or that community learn more about what's going on and how the decisions that they're making or the access that they don't have can be impacting their health. But it's when you know you can make a difference. It's when you
Yeah.
don't know that you just continue as is. So that's definitely the case. So, Chris, this has been a very, very powerful conversation. But before we go, what's one thing you want listeners to remember about Safety Net Connect?
If you want to put your health plan in the business of providing more access to specialty care, we're your team. We're your
Yeah.
partner. If you need to augment, if you need to alleviate the pressure on the existing specialty groups, we can come in and help.
Okay.
And we'd love to. And we'll just give you advice if you don't even need to use this.
Hmm.
We know other groups that can help provide specialty care too, if you're just looking for a few things. So.
Awesome. So, where can people go to learn more or connect with your team?
We have a website, Safety Net Connect. There's an info. You can just hit it. We will respond within that day. And yeah, there's a bunch of information of the other types of solutions we provide on there, but everything's surrounds access to care and helping safety net populations. That's the name, Safety Net Connect,
Yeah,
get better health care.
I like that. I like that. So, overall, thank you, thank you, thank you for joining me. And to our listeners, if you heard something that resonated with you today, please do not wait. Reach out to Chris. And because Access doesn't scale by accident, it scales through partnership. So thank you for joining us on Access with Lydie, and stay tuned for the next episode.